So if you are a content strategist, Brandy, this one's for you. If you're a content strategist and your job is to speak to physicians, what action steps should they take to add the most value to their team right now?
One of the things I think it's always important in anything that we do is really understanding what that user needs. So the action steps, I would say, are to really start to kind of map out what it is that you feel your physicians need, and begin planning to address those needs, you know, with the different content you have. And I was thinking about, like, even the team itself, you know, you have to be very resilient because things change often. And so you have to continue moving yourself forward to understand the data. So just some of the nuts and bolts of being in content strategy, looking at that data, making sure the action steps there for the physician. The physician, even though it's a physician, they're people as well, right? So it's really remembering that and starting to just continue producing things that are going to meet their needs, that they will be able to take it very practically into their practices, to be able to manage their practices, work and cater to patients. So in a nutshell, I think, you know, really just remembering who that target audience is, and that action step is just, you know, doing your research and being able to execute.
Absolutely. Okay, Lisa, let's say you are a content strategist charged with communicating to a patient audience. How can I be as valuable as possible to you right now?
I think, as I mentioned before, I think with the pivoting is answering questions with also an eye toward providing comfort and reassurance and being a trusted resource. One other thing I would say that we've been trying to do throughout this whole crisis is also to encourage two-way communication, in the sense that, you know, we're doing these Facebook Lives. Of course, everybody has their social accounts, but engaging with the public. Also, you know, in our case as a hospital, you know, everybody wants to share their PPE and they want to donate meals to our healthcare workers. And they also, you know, so we enable that, but we also are just, you know, like I said, with the two-way, you know, we create a campaign where folks can just thank us for the work that we're doing and pass along that information to our doctors. So I would say, sorry, I went off on a little bit of a tangent, but I would say we need to encourage that dialogue with the patients to be a trusted resource. So open to things that we didn't think about, and providing, you know, evidence-based care in a compassionate way.
I love it. I think that is so key. As a content strategist, the most valuable thing you can do right now is figure out how we can hear from patients, not just talk to them. I totally agree with that. Stephanie, if I am a content strategist and my UX designer is pulling his or her hair out, how can I be of value to that person right now?
I think I would go back to what I said earlier, which is outcomes-based decision-making, right? So rather than putting ourselves in a situation where we're driving what we think the patient should want or should need or should have, right? It's turning it around and pivoting so that we're looking at it from the outcome we hope to see and working backwards from there. And we've had really good success and a really nice alignment with our UX and UI designers in solving problems in that way. You know, starting from that backside, what's that outcome, and bringing it backwards in that way.
Kimberly, so go ahead. Yeah,
I would say that instead of pushing, you know, the content that we feel is most needed, we have to really listen to what people are asking for in real time. We have a live chat on multiple pages right now, and so the people are able to ask us questions when they don't want their loved one maybe hearing this conversation. And so those sort of questions, and what our help center is getting, that is determining what content we can create, you know, how we can preempt those questions and help solve for those and make sure that we're giving them what they're looking for.